So I'm here with my son, Kyle. These are the top pelvic floor exercises for men. You'd be surprised how many men come in and out of my practices, sometimes prompted by their wives, but sometimes on their own. And we just need to get men moving. And oftentimes men are really tight and restricted through their whole pelvic girdle. Not only their pelvic floor is hypertensive and short and tight, but also their pelvis doesn't move well. So the first thing that we like to do is to actually get their back extension motion moving well. So what he's going to do is he's going to put his hands on his buttocks first for me. Think of this, there's certain nerves that we're after, and you're going to glide and slide these nerves, and he's going to go into back extension. So he's going to go back into back extension. He still has a little bit of tone in the belly as he goes. Back. Why are we doing this motion? We want the nerves to have good feedback and good avenues to actually give their information to. So what happens is that there's significant areas in the lumbosacral spine that if those nerves are not moving well, then they're not going to feed the rear of the floor and the rear of the tissue of the back and the legs appropriately. So we need that lumbosacral area to move. We also need their upper thoracolumbar area to move. That's between their rib area and where the lumbar spine comes together. So it's just as important as well. So he's going to take his hands, he's going to put them behind his neck in this position. He's going to keep his elbows close together as he goes. He's going to try to stabilize his core here. So he's going to pull his belly muscles in, and he's going to try to just make his motion happen here. He's going to go up, look at the ceiling, and follow. That's now going to mobilize all the neurological pieces that feed the what? The abdominal pelvic area and then the front of his legs. So if you have men who do not have mobility, whether it's in the lumbosacral spine or the thoracolumbar area, they are not going to have good pelvic floor function and good pelvic floor control. Remember, when we look at pain patterns for men and women, we always say everything that's inside the line of your underwear has a different pain generator site than the pain patterns that exist outside the underwear line. So if they have pain in their low back along with their floor, or if they have pain in the front of their legs along with their floor, we know we have to look at these two areas of their spine. It's very significant. So that lumbosacral extension that he did here and then this thoracolumbar extension are great ways to actually make sure that we're getting good neurological information to happen. The next thing he's going to do is he's going to put his hands on the wall for me. And he's just going to lay his elbows here, feet under you just a little bit more towards the wall. Good. So he's a little bit squared off. We are kind of stacking upper girdle and lower girdle. He's now going to tighten these deep abdominal muscles. He's going to pull them up and in and do a posterior tilt. So this is going to rock backwards. He's trying to drive the motion not out of his glute muscles, but out of his deep abdominal muscles. Having the power out of the deep abdominal muscles gives stability to not only the whole girdle, but the floor as well. The floor will automatically give you a nice contraction as you're posterior tilting. If you do not feel that, you can always feel between your sitter bones, that's that perineal body area, and you can try to bring that tissue up and in. It's almost like when you get in cold water and your testicles kind of lift up towards your nose. So as he posterior tilts, he can do that little bit of a testicular lift at the same time. In this same position then, once he gets the handle of these posterior tilts so he can move nicely in a posterior tilt and hold, we also want the rest of his low spine to be mobile. Why do we want it to be mobile in different positions? Because he needs this to be pliable in here. So what he's going to do is going to bend his knees slightly, and then he's going to do a little bit of rotation with his hips. Why is he doing that? Because we need to know that he has rotation each direction of the pelvis. Think of it again, I need lumbosacral spine and thoracolumbar spine to have movement patterns, so I have all the nerves feeding the floor, feeding the front and the back of the abdominal pelvic region and the legs efficiently. If I don't have spinal motion in here, trunk motion, there is no way I can have efficiency of the pelvic floor function. So this derotation is a great way for that to happen. In this same position then, with just a little bit of a bent knee, what he can do is he can practice doing what we call a penile lift. So think of this. He's in his little bit of squat. He's just going to pretend like he's lifting the penis. I know you can't see that at this point in time, but as he does so, he will actually feel the deep abdominal muscles giving him a contraction as he's trying to practice that penile lift. Remember, different muscles lift different things in the floor. So he practices penile lift. He can do 5 quick penile lift contractions. He can do a lift and hold for a 5 count, a 10 count. You must unravel how the pelvic floor contracts. In this same position, he can now do a testicular lift as well. Again, the testicles should rise up like they're going towards your nose. You can do 5 quick testicular lifts. Some of my men patients who come in can't do them at all, and we teach them, hey, this is what you're practicing at home. The penile lift is different muscles than the testicular lift. And then in this same position, we'll move to the anal sphincter contraction. If they're pretty tight in their floor, what we might have them do is open up their posterior floor more. So we might have him lean to the wall. So now he's put this on nice big stretch. I'll straighten his legs out. I'll drop his arms just a little bit more. Look at what happened now as I've opened up the rear of the floor. He's got nice elongation to hamstrings. He's getting a release to adductors. In this same position, think of it, he can practice penile lift. He can practice testicular lift, but it's a great way to practice external anal sphincter contraction. So he can do 5 quick anal sphincter contractions here. He can do an external anal sphincter contract and hold in this position as well. So this is a great position to put things on stretch. Some of you that have that really tight rear floor, you're walking around and your glutes are always on fire. Great position for you to elongate things in. And think of it, man on top in sexual positions. We want to practice here because think of it, if he doesn't have the ability to anterior posterior tilt, so stay in that position you're in, and then just anterior posterior tilt your, yep, there you go. So think of it, that's a contraction, right? So penile lift happens here, and power happens here so that you get good penetration, right? And relaxation, he's going to drop. So this is a great position to practice in. He will pump, and we kind of call that a nice pumper position. So he can practice penile lift and pump of pelvis in this position. So easy pelvic floor exercises for men to practice in. We're not contracting all the layers of the floor at once. We're teaching people to do penile contraction, testicular lift, and also anal sphincter. Depending on positions that you're working on in your sexual activities, it's important to do all of those in those positions. So stand at the wall for me one last time. And a lot of people will do what's called a thruster position. So think of it, it's like they do penile lift, posterior tilt, and a little bit of back extension. So he's like going right into the wall and he's just dropping it in. Good. And he's doing that motion. It is a great motion for what? For us to get way more mobility through that whole spinal region, right? But also the floor, knowing every layer of the muscle tissue it should be contracting. So great for sexual health for men.